Happy Friday. Today I wanted to talk about swelling after a tummy tuck. So at the 2-day post-op mark is when you can take your garment off, your tape, gauze, basically everything except for the steri strips, which are the thin paper tape that cover the incision. You'll get in the shower, you'll wash off, pat the steri strips dry, and then put your garment back on. So at that 2-day mark, you'll definitely notice a difference. You'll notice less skin on your belly. You'll notice, your frame coming in more, a tighter waist. And after that first shower though, you are going to start to get very swollen up until 7 to 10 days post-op. And the swelling just continues to increase. So it definitely gets worse before it gets better. And so that can be a little discouraging to patients and also a little worrisome because not only are you going to be swollen in your tummy and your back and waist where you have the lipo, but also other areas of your body are also going to get very swollen. Some patients have puffy eyes from fluid retention, their hands get puffy and swollen, their ankles, their feet. It can happen all over your body. But it's just important to know that this is normal. A lot of fluid shifts happen around the time of surgery. So just stay hydrated, have your protein level, up, be sure to eat well, walk around and ambulate. That's very important. And then when it is something to be concerned about would be if you had one side that was asymmetrically more swollen than the other side, like for example, in your calf. So if one leg is significantly more swollen and tender and painful, maybe even red, then that is definitely a time when you need to contact your doctor and probably go to the ER to get evaluated to make sure that you don't have a DVT, a deep venous thrombosis, which is a blood clot that could potentially travel to your lungs. It's very rare to get that after surgery, but out of all the surgeries we do in plastic surgery, tummy tucks are the most common ones to get a blood clot. So that would be something to be looking out for, is if the swelling is asymmetric, especially in the lower extremities. But overall, the swelling will continue to get better with time. The first week or two are the worst, and then it definitely improves. At 1 month, at 6 weeks, you're going to start noticing major changes. You're still going to have swelling kind of like waxing and waning for months after surgery. Some patients even say up to a year, but it gets significantly better at the 4 to 6 month mark. That's why we usually say that final results for the tummy tuck are evident at about 4 to 6 months. But I like to say that the liposuction areas continue to get better up until a year, since you still will have swelling there and it takes a good while for that swelling to resolve. So I hope that was informative and I hope you have a great weekend and I will see you next week.